really difficult in this community to find somebody or a group of people who treat all three. Many of our patients come to us and they have a specialist for their gut and their mast cell, and a specialist for their musculoskeletal issues, and a specialist for their dysautonomia, and to treat that. And I think what makes our group really helpful for people with EDS is getting all of that care in one place. So you don't have to go to many different places. And also using a combination of providing, the way I treat this is a combination of providing conventional medicine, but also giving people the option of using integrative modalities as well. And so we'll talk a little bit about those integrative modalities today. But there's a lot of up and coming research. What's also important to know is that long COVID, like I said earlier, has shed sort of light on a lot of people who have EDS that didn't know about it before. There was a UK COVID symptoms study biobank that had hundreds of thousands of individuals, and it actually found that people with EDS are more likely to not have recovered fully. So there's definitely this connection. There's also many studies that have shown that many people who get long COVID symptoms end up finding out later that they also had EDS, this genetic condition that they didn't know about. So it's definitely coming more to light. It's big on people's minds right now, and hopefully we can share a little bit more about how we're treating it. So I will give it over to Dr. Kogan to talk a little bit about the diagnostic process.
Hi, everybody. Welcome. Sorry, we started recording a couple of minutes late, so we'll figure out how to edit this better. So as Ashley brought up, in essence, this condition is, I like to call it an orphan condition, because in reality, despite the fact that it's a lot more common than people realize, it's still in standard statistics. If you just look across how it's reported in the medical literature, it's basically probably at least tenfold underreported. And the reasons for that are multifactorial, but I would just name one particular one, and simply that the standard of care has no answers for this condition, no treatments, no effective supportive care. Basically, unfortunately, most patients who have complex EDS symptomatology end up being shuffled between specialists, with very rarely being effectively managed. That's what we've been observing. That's what a lot of our patients have told us. So I'm going to bring up just 2 points and then pass on to the next speaker. So first point, genetics. We get asked, so should if you have some kind of suspicion that you may have EDS, should you be getting genetic tests? And the short answer is absolutely yes, because the positive test gives you a very strong statement that you do have the illness, and you cannot be ignored. I would say something critically important, that the standard diagnosis requires either hypermobility or filling up a special process where a questionnaire is filled up and it's like a checklist and certain things have to be met. The reality is a lot of patients who have the EDS don't fit into that check boxes. Either they don't have hypermobility at all. Hypermobility is absolutely not essential for diagnosis of EDS. It's only one of many subtypes. You could call this a mixed connective tissue dyslaxity or laxity, or you can have a variety of names. The problem is that these names don't really define much of anything, because they don't really help you to manage the disease or manage the condition. And so genetics can be helpful. And if one provider told you don't have it, it doesn't mean you don't have it. You have to keep on trying to figure out what was missed. So that's one big point in diagnostics. And the second point, I would say, I'm not actually going to talk a lot about management, because we're going to have each practitioner going after me discuss their particular angles and how they manage this. But I will mention there's one member of the team which we don't have today. It's actually not directly in our clinic. That's why this member is not here. But that's a physical therapist. We often affiliate and send our EDS patients to practice called Thrive Again. But there are a lot of practices in the area that specialize in EDS, and this is a critical part of the team. Having a manual therapist who knows your body very well, who can see you on a very regular basis, more importantly, who can understand exactly what's happening. Why is this particular microtrauma happen? Why are you having pain over there? Would be very essential. I don't think it even matters whether that person is an osteopath, physical therapy, a chiropractor. I think it's just that person has to be very familiar with not just EDS and the key principles of what it means, but also with you personally. And, I think unfortunately there's a huge shortage of such people. So with that, I will pass them back to Ashley, who will tell us who is our next speaker.
Yeah, so our next speaker is Dr. Embry. I'll let you go next.
Hello, I'm Dr. Embry. I'm the integrative psychiatrist at the center. And I guess I do work a lot with people who have comorbid conditions. So anxiety and depression obviously is what I work with, but certainly a lot of people with Ehlers-Danlos and even, other chronic medical conditions have comorbid anxiety and depression because chronic illness can lead to changes in mood, changes in, levels of anxiety, especially if someone is going from specialist to specialist. And with, as Ashley mentioned, with Ehlers-Danlos, you have people going to cardiologists, to gastroenterologists, to physical therapists, and other, musculoskeletal providers, whether it's rheumatology or, maybe even neurology in some cases. So carrying this burden, is a huge weight and often leads to, depressive symptoms and anxiety symptoms. The other piece is that this condition has so many organ systems involved. So you have the nervous system involved, you have the vascular system involved, you have the gastrointestinal system involved, and all of those systems can, when they're not working properly, can negatively impact the mental state. One other piece that is helpful to understand why mental health is supportive for EDS is that the most common form of EDS is the hypermobile type. And that form of EDS is often correlated with this genetic mutation called the MTHFR mutation. And what that means is that when someone has this mutation, they have difficulty methylating their folate. So folate is a key nutrient and a key catalyst to a lot of chemical reactions in our cells. One of those, or many of those reactions, have to do with the building of neurotransmitters that support brain function. So serotonin, dopamine, norepinephrine, all of these are key neurotransmitters for brain health. And when we're not able to methylate folate, then we have difficulty producing these neurotransmitters. So it can lead to decompensation on the mental and emotional sphere. As far as an integrative approach to Ehlers-Danlos, Ashley mentioned why that was so key, because there are so many systems involved. And that's also one of the reasons why I like working with EDS population as well as people with chronic medical illness, because I utilize a form of medicine called homeopathic medicine, which it's a very elegant form of medicine, and you can stimulate the body's ability to heal itself. So it almost acts as all of your medical team. It works to support all of those things. Like it can support your vascular system, it can support the neurological system, the gastrointestinal system, all of these things that are compromised in Ehlers-Danlos. It allows the body to heal itself, and that a lot of integrative approaches do that. So that's one of the reasons that I think that this form of medicine can be really supportive for EDS, because it reduces the complexity to, the simplicity of just a single, maybe, one or two remedies that can be supportive for the whole system, and, the mental health as well. So yeah, if anybody has any questions about that, feel free to reach out to me.
Dr. Rowe next.
Great. So I'm going to just talk a little bit about yoga therapy for EDS. Now, I'm also a doctor of Ayurvedic medicine, and in Ayurvedic medicine, EDS would be considered primarily a Vata condition, but there can also be Pitta type components and Kapha type components that can influence symptomology. So I might say a little bit about that. But basically, what I want to really get across is that people with EDS can safely do yoga under the guidance of a yoga therapist who will develop a protocol tailored to meet their individual needs. So this will almost certainly not match the instructions you receive in a community yoga class. So that is where folks with EDS need to be really careful attending community yoga classes. Therapeutic yoga is for people with EDS is going to be about strengthening and stabilizing rather than lengthening muscles and rather than creating more space in the joints. It's going to be about restraint rather than pushing yourself. And of course, you should always stop if you experience pain. So one of the things that's useful is to use props in an intelligent way to maximize balance, stability, restraint, and endurance in poses. The wall is a great companion in yoga practice to work on balance poses, focusing on proper alignment and definitely not comparing oneself to others, because the way that somebody with EDS can benefit from a therapeutic yoga practice is not going to look this similar to the way somebody without EDS would approach therapeutic yoga. Don't accept adjustments if you attend a community yoga class, because those can really exacerbate symptoms and problems. No jumping transitions or moving quickly between poses. Move slowly and deliberately with full attention. Consider avoiding flow sequences and taking time for the body to reset and integrate between individual poses. And obviously, we want to avoid hot yoga and vinyasa and engage with poses that require a muscular effort, but through appropriate muscle alignment, activation, hugging the muscles to the bones to support joint stabilization and avoiding creating additional space in the joints. And just to clarify, restorative and yin yoga may not focus on stability and strength, so don't assume that those are safe by definition. It really depends. There are 8 limbs of yoga. So people with EDS can benefit from all 8 limbs. Asana is just one of the 8 limbs. I won't go into all of them, but just to say a tiny bit about Ayurvedic medicine, which is a comprehensive personalized system of primary care, treating the whole patient. And EDS, as I think I mentioned, is a Vata type condition, but can be combined with other doshic imbalances, depending on the constitution of the patient and their imbalance. And so when we treat a patient for EDS, we're going to take into consideration the digestive conditions, the nervous system conditions, not just the musculoskeletal system and the connective tissue. So basically, another thing that I think it's important to recognize is that we're going to use a comprehensive body systems level approach. And one thing that's great for treating Vata conditions is to establish regularity. So whatever it is you do decide to do, to stick with that and not engage in too much therapy hopping. Give it a chance, see if you can get it to work, because therapy hopping is kind of something that happens when Vata is aggravated in any particular individual. So I think that's all I'll say for now. And then if there are questions, I'm happy to answer those at the end.
Great, thank you so much. I'm gonna have Angela go next.
Hi, everybody. My name is Angela Gabriel, and I've been acupuncturist for 20 years and somatic experiencing practitioner for about 3 years, mostly at the GW Center for Integrative Medicine. And now I often combine these 2 specialties. So as a Chinese medicine provider, I see patients with EDS quite often. Most typical complaints are pain and ache in the whole body, frequent injuries, digestive issues, sleep difficulties, anxiety, and so on. So in Chinese medicine, we identify a pattern of imbalance in the body and energetic systems where energy is stagnated, which part of the body, which tissues. Is the stagnation due to deficiency of energy, blood, and fluids, or due to their obstruction by excess in certain areas, or a combination? For genetic disorders, we work with the kidney adrenal system, which is related to so-called prenatal essence. And connective tissue is controlled by liver channel system, whereas spleen controls digestive system and muscles. So we use acupuncture techniques such as needles and other things like moxibustion and cupping, different types of tuina massage to restore that flow of energy, blood and fluids in the body, and improve nourishment of specific organ and tissues, specifically muscles and connective tissue. So some of my patients also receive dry needling at their physical therapy office for tight muscles, and it works charm for a lot of people. Does not do almost anything for some patients. So this is what I noticed. So in this case, acupuncture can be very helpful because it's much gentler and it's for the whole body, not just local tightness. So some of my EDS patients prefer actually quite light needling and a lot of moxibustion, which is a heat therapy. A lot of my EDS patients continue acupuncture for many months and years. So it's in essence, it's a maintenance therapy, and they come as needed, sometimes weekly or bi-weekly, and other times maybe once a month or so, depending on how they feel. So with acupuncture, not only helpful for pain, but also for indigestion, insomnia, and mood, such as anxiety, and depressive mood. With somatic experiencing, I'm also a practitioner of SE, so-called. I use my knowledge of autonomic nervous system, and I tend to help autonomic dysregulation. So with acupuncture, which is helpful for that too, I also use specific exercises for nervous system, SE techniques, different explorations, tools, all aim to regulate vagal tone and autonomic nervous system, which in turn helps to reduce sympathetic activation in general, inflammation in the body, and also reduce mood problems. So there are, of course, other topics that I discuss with my patients, like diet, lifestyle, adjustments, meditation, exercises like breathing and Qigong. Qigong is great because it's very gentle and slow. It does not use repetition. It's well tolerated by ligaments and joints of EDS patients, and it can increase energy and stamina. So I think it's all very beneficial for EDS patients, and as a part of the comprehensive approach, and also makes them feel in charge of their well-being, because a lot of these things they can take home and continue practicing. So thank you for your attention, and I'll be happy to answer questions as well.
Awesome. Thank you so much, Angela. I'm going to have Joelle go next.
Hi, I'm Joelle. So I work as a cannabis consultant at George Washington, and cannabis is actually very helpful around many EDS symptoms, especially pain, including muscle pain, muscle spasms, sleep, chronic fatigue, GI issues, including gastroparesis. And ultimately, it's going to result in a reduced pill burden. And its real beauty is it can address all of the most troublesome and difficult to treat symptoms at the same time. It's very much a multi-target drug. And once the pain's controlled, you can begin to participate in physiotherapy and regain muscle strength and experience fewer joint dislocations and eliminate opioid requirements and ultimately appreciate a fuller and richer quality of life. And people generally associate cannabis with smoking, and that's certainly an option. Some prefer it because of the immediacy of the effects. As soon as you inhale it, you will feel pain relief, relaxation, a sense of well-being, stress relief. And options now include, in addition to the flower, the raw plant material, vaporizing, and their products like cured resin or live resin, which is they flash freeze the cannabis at its peak so that all the trichomes and the most helpful and useful parts of the plant are captured, and they transform this into an oil that can be vaporized. And so you receive all of the benefits of the plant, the cannabinoids, the terpenes, the flavonoids. It's very fast acting and effective. Some vape cartridges also include CBD. They combine THC and different levels of CBD, as do some of the plants are now grown, hybridized to include these varieties. CBD is non-intoxicating. It won't get you high, but it's very helpful for things like anxiety, stress, inflammation, and it definitely soothes the GI. So these combinations are very helpful. And for people who are avoiding smoking any inhaled products, they're tinctures. So tinctures are concentrated cannabis medicines that come in a small bottle this size or maybe twice this size. And they're used by the dropful. And in addition to cannabis, there's MCT oil, coconut oil, or alcohol. The alcohol ones are a little faster acting. They definitely sting if you put them directly into your mouth. But the tincture, it makes cannabis very easy to dose because it's literally by the dropful. And some of the tinctures are very concentrated, up to 1,500 milligrams in a little bottle, so that the dose would be a single drop. And that would be for somebody who's in extreme pain. We also like to use a tincture approach for people who want to stay clear-headed during the day. And to do this, we'd start with a CBD tincture and gradually add the THC over time so that you're not altered. And eventually you'll find your sweet spot where you're feeling, relief from all of your symptoms and you're not altered in any way. Some other options with cannabis include topical salves. These will penetrate through the layers of the epidermis, but not into your bloodstream. So you'll get relief, but not be altered. We also have so many varieties of gummies and lozenges, different levels of THC and CBD, capsules, honey. We have different honeys that combine these products. And when I say we, I also work at Tacoma Wellness Center, a very nice medical cannabis dispensary. And the products I'm referencing can be found there. We also have suppositories, which sounds like an unlikely choice, but for people who have GI or pelvic pain or lower back pain, these are wonderful because they quash the pain in that region and they don't penetrate into the bloodstream, so you won't feel altered, but you will really receive complete pain relief in the region. For somebody who has a lot of pain, we probably recommend a RSO, which is a Rick Simpson oil. So this is the most concentrated form of cannabis medicine. It comes in a syringe. It's not injected, but you just push out a tiny bit. The dose is actually 1/2 a grain of rice. And the effects will set in about an hour and they'll last about 7 or 8 hours. We also have bath soaps, which are excellent for relaxation and for the GI. And also won't penetrate through to your bloodstream. So they're just extremely relaxing. If you're a problem sleeper, it's great to have a THC bath soap before bed because it'll really, really relax your body and allow you sleep. So these are the ways that cannabis medicine can help with EDS, and I'm happy to talk with any of you about it.
Thank you so much, Joelle. I'm gonna have Audra go next.
Hello, everyone. As we know, food is really key to life, and nutrition plays an important part in EDS, though it's not fully understood. But what is known is that in addition to genetic issues, there are also nutritional deficiencies with people who have this disease and all of its manifestations. What they're finding is about 70% of people who have EDS in whatever form can also have gastrointestinal issues, which would include heartburn, constipation, pain in the abdomen, bowel changes, a whole host of irritable bowel syndromes. And so, it's known that it really affects our ability to eat and also to get enough nutrition. Research is also finding that a lot of people who have EDS are nutritionally deficient. And so it's not known how much that plays into getting the disease, or, it definitely helps in managing it. So a lot of people are deficient in vitamin D. And a lot of people, for various reasons, are deficient in protein. And as we know, protein in particular is needed for muscular movement. And vitamin D helps our bones to stay stronger, or, be, hard enough and have enough minerals in them to allow us to have mobility. There's also information that a lot of EDS patients have celiac disease, and so wheat is a problem, as well as alcohol and coffee. So that causes a lot of symptoms. So researchers are putting together a lot of this information. And because of these nutritional deficiencies or inability to process food, there is a lack of ability of a lot of people to exercise. And exercise is key to the body. So when you can't exercise, or when you don't have enough food or energy from the food to carry on day to day, that's a serious problem. So, it's really going to take an effort on the part of the people who have it and their caregivers to figure out, what particular foods trigger symptoms. And so that can involve being more mindful of what you're eating. Some people are finding that smoothies and pureed food is much easier on the bodies, and knowing which foods trigger you. So the clients themselves sometimes are going to have to do a lot of work in figuring out, logging their foods to see which foods trigger and which foods don't, or less triggers. And so that's going to be a real important part of the work. And with kids, that's going to be a little bit more challenging. So some kind of log or process to really work on that. And as well as all health professionals working together. So one of the problems with EDS and food is that people get afraid to eat, because they don't know what kind of reaction it's going to have, and it feels safer sometimes not to eat a whole lot. And so, eating disorder is one aspect that can develop. And so it's going to take a whole team to work together to figure out, how this is manifesting in people individually, and what can be done. We've talked about other ways that could help to manage the problem, but food is a big big issue here, and yeah, it's going to take a lot of work to figure out, because we don't know a lot about it, but we do know that there are a lot of nutritional deficiencies, lack of protein, and other issues. So I think that is pretty much what I wanted to say about it. That we have to deal with that anxiety about eating, making sure that there's enough nutrients. And some people, can take supplements and still not have enough of nutrients. So it's a really detailed disease that's going to take a lot of management. Thank you.
Well, thank you so much, Ajwa. I think we are doing quite well on time, so I'm going to take liberty and introduce our Thrive Again team. I'm trying to figure out where they are. So it's either Nava and Jessica, or maybe just Nava. So Nava, I see you. So let me spotlight you. I don't know where Jess is.
I'm not sure if that's Jessica or a different Jessica.
Yeah, so that's fine. It doesn't matter. So what I mentioned before, that we send a lot of our EDS patients to Thrive Again. I'm putting a link to your practice in the chat. And Nava, maybe you can tell us just a couple of words about how you guys address this. You have mostly physical therapy practice, and just talk to us about what you guys do.
Absolutely. So yeah, we are a physical therapy practice. There are 5 of us now, and we are primarily manual therapists. So when we think about hypermobility, manual therapy isn't always like front of mind. A lot of people think like stabilization, things like that, and that's something that we incorporate as well. However, the balance in the tissues is really important. So if there is, for someone might be like a small restriction, like either in a scar or something else, one joint is tighter than the other, it can really throw things off in the body in a really big way with these syndromes. So we really focus on balancing out the tissues. The other piece is that when we're doing manual work, it's an interaction with the nervous system. So even the tissues that are kind of like almost floppy, right? That we can do manual therapy, and we're not going to take away the hypermobility, but we can kind of wake them up and make them a little bit more active. And that can be really beneficial. So we do a lot of osteopathic techniques for the spine. We do visceral work, so mobilization around the abdominal organs, pelvic organs, around the thorax as well, and craniosacral therapy. And all of these therapies are really oriented at restoring the balance in the connective tissues, so that when we go and add the stability and these other beneficial things, sometimes it's bracing. SI belts can be really helpful, but really looking at each person individually and figuring out, okay, what are the pieces that we need to put together so that mechanically things are optimal for them. We also are pelvic floor specialists, and we do find that a lot of our pelvic floor patients end up having some type of hypermobility syndrome as well. And I missed the first few minutes. I really was hoping to be here more, so we may have talked about this, but things like endometriosis, painful bladder syndrome, I know IBS was mentioned, right? So these things coexist. So we do find that even if we're not advertising as like an EDS clinic, is that based on the nature of what we do and treating complex syndromes and complex like chronic pain, pelvic floor, all of these things, is that we end up seeing a lot of people with EDS, with hypermobility, and that kind of develop an expertise in working with those patients.
Great. So Ashley, let's you and I come up for spotlights. And I think we're right on time, just like we planned. So let's go to the questions then. think we keep trying to cancel each other's spotlights here. Sorry about that, everybody. It's okay. There we go. I think we're okay. That's good. So if you're comfortable bringing up your questions for the whole group, do that. Otherwise, we're closely monitoring the chat. So if you have a specific questions about your own health to either one of us, to Ashley, me, or any other practitioners who are here, by all means, send directly messages to chats, and we're all going to try to respond. But if you're comfortable bringing us to the whole group, let's do that, and we're just going to take questions as they come. And if there's no questions, we have unlimited number of points that we can discuss. So do you want to, let's start with.
Yeah, it looks like there's already a chat, and I don't know if Nava wanted to come back for a moment and answer this one, but it's about Thrive specifically, and manual therapy, and how they find that it's just not holding after they get it done.
Sorry, I'm eating lunch at the same time. Yeah, I mean, that can definitely be an issue, and there's not like a one size fits all solution, but we want to figure out why that's happening. So, sometimes it's, that you need certain bracing, right? It's like, okay, we can put things together, but if the tissue isn't holding, then we want to add support externally. Sometimes it's these other, integrative treatments, like what's going on systemically, and do your tissues have the nutrition and support they need to function optimally? And then sometimes it is finding like a deeper cause of the problem. So, visceral restriction can be a big part of this. Sometimes we see people with, chronic shoulder, chronic back issues, and it's because, they had a car accident and then the liver is in tension. So, yeah, so it's tricky, but there can be kind of underlying things that we can uncover by, working in a personalized and systematic way.
And then I think there's another question about macular degeneration can be related. And yeah, there is some evidence to support that. And it makes sense, right? Because if it's a collagen disease, it can affect the collagen that's part of the retina as well. Although I would say it's probably one of the more rare risks that can happen with EDS. It does happen, especially in classical or vascular type EDS.
I want to add just a word about this, that the therapies don't stick. I mean, it's 100%. Now, I think, unfortunately, Lauren, that's very fast non-response, or rather response, but then recurrence. Even before you get home, it happens. But that's unfortunately the whole principle of this condition. I mean, there is no cure, there's no fix. I mean, maybe at some future point, stem cells or some other genetic modification will be available. But at the time, the only thing we can do is to continuously support the balance of the system on every level. And I think you heard that different practitioners were giving you same sort of information from different angles: nutrition, manual, energetics, like with acupuncture, for example, psychological. So I think all of these things, all we can do is trying to help the system to restore as much balance as possible, and then managing micro trauma and pain to the best without, and I'm going to keep repeating this, I think it's fine, without really standard of care. Because unfortunately, if you end up in a standard healthcare system, you will be given medications. I can guarantee you that. And the problem is they're not helping to restore the balance. They're going to throw the balance off. If I were to give floor right now to Jennifer or Angela or Ashley, they would have told us that from an energetic perspective, medications often cause a lot more harm than any benefit, because in the long run, they throw your balance further away from the middle line. And, and that's sort of the problem. The medication should be used only as a last resort for this condition. And it's a really important concept that I hope you sort of understand. Otherwise, I think the fallout will be ever increasing number of symptomatology that further requires more medications, like a nonstop cascade. Actually, can I invite all of our practitioners now? Thank you so much for doing this, to put your emails in the chat, so that if somebody wants to directly reach us, by all means, that's a great idea. And I'm going to do the same with my own email too.
Yeah, I'll do that as well. The other part that I'll say about, especially about things not holding, and this may not specifically relate to it not holding, on your way home from the appointment, but just in general, our diseases, right, are a context of our entire lifestyle. And so when we're thinking about things, even beyond sort of the pain or the dislocations or the musculoskeletal components of this disease, and we're looking at things like dysautonomias or MCAS, whether something holds or not is also going to be affected by our lifestyle and how much we're doing, right? That pacing component can't be understated. And sometimes, even being a sufferer of dysautonomia myself and MCAS, sometimes we have to change our lives in certain ways or accommodate them in certain ways to allow those treatments to hold a little bit longer. So that can be a factor as well.
Ashley and Nava, there's a question if you know anybody at Inova, any physical therapist who is good. I don't.
I don't know off the top of my head, but I'm happy to talk with anybody by email and we can try to figure something out.
And then Nava, I think that's also for you. There's a question from Melissa. It's a long question, so I'm just going to read this. So I've had 15 years of chronic pain in all 3 hamstring muscles due to the tight muscles. I feel like my muscles are relying so much on manual therapy to recover, and despite doing PT exercises, I don't seem to be getting stronger in other surrounding muscles. That's a great question for you. I know you will have an easy answer to that. What can I do to do when my mobility continues to decrease and I've becoming severely limited with how many steps I can take?
I was typing an answer to this, but I'll try to answer it verbally. So I think that manual therapy, I think, is helpful, but it depends on what that therapy is in particular. With tight hamstrings, it's usually a symptom of something else, whether it's nerve tension, whether it's the core stability, whether it's some dysfunction in the spine. So getting to the root of what's causing that is really important. And then I think the other piece, and I'm sorry, I forget my colleague's name who's talking about nutrition, right? If we're talking about like being able to strengthen that protein piece, I think probably is very important as well.
What I'll also say about chronic pain is there's a lot of research coming out about low dose naltrexone or LDN in patients with EDS. And so often we use this as a way to help with chronic pain, and I've seen really good results with it.
I see that there's a hand up. I'm guessing somebody may not be able to type. So Crystal, do you want to ask your questions if you actually meant to raise your hand and ask?
Yeah, I did. Can you hear me okay?
Yeah.
I guess, can you talk about what an initial consultation looks like? So like we call and we make an appointment, like we're looking into like for my case specifically, like there's possibilities of other diagnoses that haven't been made yet based on symptoms that we're currently seeing. So like if we come into the offices, like what does that process look like?
Yeah, I can talk a little bit about that. So it's going to be a really comprehensive intake, usually about 90 minutes in length, and we're going to go over your entire health history. And it wouldn't be unusual. I have patients who are in their 40s who've been dealing with symptoms their whole life, and they're hearing EDS for the first time, right? And we're able to diagnose them. So then from hearing your history and your story, we would order diagnostic testing. If genetic testing was appropriate, we'd order genetic testing. And some of these tests may be what they call functional tests that are looking at things on a cellular level or related to the gut. And some of these tests would be tests through your normal LabCorp type of a clinic. So, and then we would come up with a plan. And I am pretty comprehensive. I do send every plan to each and every patient afterwards. I write it all out as a list and send it to you actually as a message so that there's a lot of clarity on the way forward. And that's how that look. And then I would refer you to anybody else that I thought could be a good match towards your healing journey based on your goals, right? One thing that's important to point out, Crystal, is that everyone's goals are a little different. Somebody's goals may be completely related to physical activity because that's really important to them, and other people's goals are related to spending time with their family, working, so it's going to be very tailored towards your specific needs.
Rebecca brought up a good point. So what about subspecialties, whether it's GYN or rheumatology or any? Yeah, that's the problem. I don't know any specialists in the entire DMV area in OBGYN who's very familiar with the EDS, regardless of whether it's hypermobility EDS or any other types. There are probably some integrative OBGYN who just going to be more open to listen to you, but they may or may not understand fully the complexity of this illness. That's the problem. So that represents a huge challenge. I have a same exact story with the rheumatologists because quite often a lot of the patients with EDS gets misdiagnosed as an autoimmune conditions. They would find some slightly elevated markers for something, and they will be told that you have mixed connective tissue disorder, and then they start getting suggested heavy immune suppressants and to no absolute benefit. So it's a challenge. It's a big challenge to create the team. By the way, I want to remind everybody, earlier in the meeting, I put resource to the DC EDS support group. They're wonderful. They're run by Danielle and then a couple other people. So I put their email somewhere. I don't know if I can go back and find it, but I'm going to repost as, yeah, so here it is. Just going to repost that message that I posted earlier.
And I will say, although there's not a lot of specialists that maybe specifically are dealing with patients with EDS, I do have people in this area who are OBGYNs that are open-minded and do some integrative medicine. So although they may not specifically specialize in EDS, they may be a better choice and more able to understand the other things that you're doing for your disease process than somebody who's maybe more conventionally minded. I would not say, answer Melissa's question. I would not say that low dose naltrexone is preferred over cannabis. I think that you could actually do it in combination. But I wouldn't say one is, I mean, personally, I wouldn't say one's preferred over the other. It's really going to be what works for you, and everybody's a little bit different.
There was a really interesting question. I don't know who this person is, iPhone 13 Pro Max. Is there a way to turn down laxity progression if it's increased lately? I don't have an answer to this question. Maybe Ashley or Nava can answer it better. It's kind of hard for me to understand what the laxity progression truly means. If you mean you have an increased number of micro injuries, we'll manage that. But the laxity progression, it's kind of hard to get the sense of how do you measure that even?
Yeah, that's true. And what I will say is I see a lot of patients who've had a lot of surgeries throughout their life, and I wouldn't say that that's, increase the stability either. It just ends up being sort of one surgery after another, after another, after another, almost, just kind of putting a Band-Aid on a situation that's much larger than.
I will say that I think homeopathic treatment has the potential to do that. And that's actually just from personal experience. I noticed that whenever I'm using, I actually have EDS, and when I notice that whenever I'm using homeopathic remedies that are a good match, my laxity is improved. So that's just a personal anecdote. It's not, broadly for everybody, but I think homeopathic remedies do have the capacity to prevent further deterioration and can even improve the existing laxity of ligaments and tendons.
There's a great question about telemedicine appointments. So I think it highly varies by state. I'm going to keep calling you iPhone 13 Pro Max since I don't know your name. I apologize. But you can just submit 3 minute, like up to 5 minute form to us. I'll give you a link. And we can sort of determine whether your particular state we can serve. So it depends on some of our licensing. We have more than just DMV area licenses, but it's very, it's not the whole country. We can't serve the whole
country. Kelly has a really good question about EDS and dysautonomia and this sort of burning pain. So it's really interesting with dysautonomia and EDS, there's a very high incidence of small fiber neuropathy that gets misdiagnosed often because I think everybody's really focused on connective tissue and of course muscles, and not very much focused on nerves. But your symptoms, just from reading them, outright, right, not knowing your history, sounds like it could potentially be related to more nerve physiology. So that could be the problem. And I have heard of that. So I know that your real question is, has anybody heard of this? I can tell you that just to validate you, I hear this all the time. Legs, arms, quite often.
Well, and that's also where cannabis shines. I mean, the CBG, for example, is extremely profound, low dose. You don't have to take a lot of CBD, can do that, but at much higher doses. But CBG can be very effective, and not just managing the pain. This is a critical aspect. That there's some data to show that some cannabinoids will completely restore neuropathy, meaning that it'll get rid of the nerve damage. And it's not just cannabis. I mean, that's where a number of supplements can be very effective, and that would need to be also, we also often try to look for other things. I mean, you could have heavy metal toxicity, let's say mercury, or other drivers that increase chances are actually causing this additional dysregulations, which, if you don't dig in, you're not going to figure it out. We have about 5 minutes, which probably gives us time for at least a couple more questions. So I answered the question about appointments. I suggested to send us the intake form, which I put link in the chat, and then we can determine whether your state, if we can serve your state. It really depends. Yeah, some of us offer virtual appointments for almost entire country. Some of us are quite restricted. So the naturopaths, for example, are a bit more restricted than others. But again, some of us will be able to offer a lot more. Okay. Do we have any other questions?
I don't see any other questions in the chat unless we missed one. If we did, please feel free to unmute yourself and ask. But otherwise, how will we access the recordings?
So it will be posted in a few weeks on our YouTube channel. I'm gonna give you a link to it. By all means, subscribe if you don't want to miss it. Otherwise, you have to remember. I don't think that we have an easy way of sending everybody.
No, but we could also post it on our website.
Yeah, definitely.
It will be posted on the website. I will also send it in the next newsletter. So if you can subscribe on the website, you can subscribe for our newsletter and also subscribe for Dr. Kogan's YouTube channel, not to miss anything exciting.
Yeah, I'm gonna give a link to that in a sec.
Perfect. It was good to be with all of you today. We really appreciate you taking your lunch hour here to spend time with us. And I hope you learned a little bit here today and got your questions answered. And we're happy to help and serve you in any way that is helpful to you.
We're doing this virtual open houses on a regular basis. Actually, this month we have 2, which is quite unusual. So next week we're doing one about the memory, what we call a recode program. So if you're interested, you can check our website out and find the link, or just message one of us and we'll give it to you. And thank you so much. Hopefully everybody have a great weekend. And if you still had questions and you were either shy and you didn't want to answer, or by all means, just send us a general email. You can also send us an email at info@gwcim.com. And as Angela just put in, just please check out the website, and also Thrive Again. Link is somewhere in there. Maybe now I can repost it. I'm sorry, I'm a little, yeah, but you'll see it. It's there. Thank you, everybody.
Thank you.